Have you ever looked at your itchy dog and thought, maybe it's their food? Maybe you've switched foods multiple times. Maybe you've tried a grain free diet, limited ingredient diet, or a different protein, but your dog's still scratching, licking at their paws, or getting ear infections. If so, you're not alone. Food allergies are one of the most misunderstood problems that we see in veterinary medicine. The truth is, food allergies are real, but diagnosing them is much more complicated than simply changing your dog's food and seeing what happens. Today, we're going to talk about what food allergies actually are, what signs they cause, and how veterinarians determine whether food is truly the reason that your dog is uncomfortable. I'm Dr. Matt Clark with Class and View Veterinary Clinic, and I'm here to help. This is Beyond the Vet Visit. Before we get started, I want to remind you that this video is intended for educational purposes only. Every pet is different, and the information discussed here should not be considered a diagnosis or substitute for professional veterinary care. If your pet's experiencing significant itching, skin infections, recurrent ear infections, vomiting, diarrhea, weight loss, or any other concerning symptoms, please contact your veterinarian for advice specific to your pet. The goal of this channel is to help you better understand veterinary medicine so you can have more informed conversations with your veterinarian and feel more confident caring for your pet. This content is intended to supplement, not replace, the care and guidance you receive from your own veterinarian. In previous episodes, we talked about allergies in dogs and cats, and how they can be caused by several different things. We discussed flea problems and why controlling fleas can be so challenging, including how fleas live, reproduce, and how prevention works. We also talked about how some pets can develop flea allergy dermatitis, where the immune system reacts to the proteins in flea saliva. We then took a deeper look at environmental allergies, where pets react to things around them like pollen, grasses, molds, and dust mites. Today, we're going to focus on the third major category, food allergies. Food allergies are one of the most misunderstood topics in veterinary medicine. When a dog is itchy, licking their paws, or dealing with recurrent ear infections, one of the first questions many owners ask is, could it be their food? And that is an excellent question. The challenge is that figuring out whether food is truly the cause is often much more complicated than simply changing from one diet to another. One reason food allergies can sometimes be overestimated is because changing a pet's diet often happens around the same time that other treatments are started. For example, a pet may begin a new food while also receiving treatment for a skin infection, ear infection, parasites, or inflammation. When that pet improves, it can be difficult to know exactly what made the difference. This is why properly evaluating a possible food allergy requires a careful and consistent approach. Today, we're going to talk about what food allergies are, what signs they can cause, how veterinarians diagnose them, and why a proper food trial is such an important part of that process. So, let's start by talking about what a food allergy actually is. So, what exactly is a food allergy? A food allergy occurs when a pet's immune system reacts inappropriately to something in their diet. Normally, the immune system is designed to protect the body from things that could cause harm, like viruses and bacteria. But with a food allergy, the immune system mistakenly identifies a normally harmless ingredient as a threat and creates an inflammatory response. A simple way to think about it is to imagine your pet's immune system as a security system. A properly working security system recognizing what belongs and only sounds the alarm when there's a real problem. But in a pet with a food allergy, the alarm system becomes overly sensitive and starts reacting to something that's not actually dangerous. The important thing to understand is that the food itself is not necessarily bad or unhealthy. The issue is that this individual pet's immune system is responding differently to a specific ingredient. When we talk about food allergies, we're usually talking about a reaction to a protein source in the diet. This might include proteins from ingredients such as chicken, beef, dairy, and other sources. However, the ingredient that causes the reaction is different for every pet. It's also important to separate a food allergy from a food intolerance. A food allergy involves the immune system. A food intolerance doesn't involve the immune system in the same way and may involve difficulty digesting or processing certain ingredients. These two problems can sometimes look similar from the outside, but they're very different conditions. Another important point is that food allergies are not the most common cause of itching in dogs. When a dog is scratching, licking their paws, or dealing with recurrent ear infections, food is one possibility. But veterinarians also need to consider other causes like environmental allergies, flea allergies, parasites, and skin infections. This is why determining the cause of itching often requires looking at the entire picture rather than assuming food is automatically the problem. When most people think about food allergies, they often think about digestive problems. They may see a picture in their mind of a dog that vomits, has diarrhea, or seems unable to tolerate a certain food. And while gastrointestinal signs can happen with food allergies, they're not always the most common way these problems appear. In dogs, food allergies more commonly show up as skin and ear problems. Some of the signs owners might notice include scratching, licking or chewing at the paws, rubbing the face, red or irritated skin, recurrent ear infections, recurrent skin infections, hair loss, or areas of damaged skin. One of the reasons food allergies can be so frustrating is that these signs are not unique to food allergies. A dog with environmental allergies may look very similar. A dog with a flea allergy might look very similar. A dog with a skin infection or other underlying problems could also have similar signs. For example, a dog that constantly licks their paws could have an environmental allergy, food allergy, irritation from something they walked through, or another issue entirely. The symptom tells us that something is causing discomfort, but it doesn't always tell us what the cause is. This is why veterinarians do not diagnose food allergies based on itching alone. We have to look at the entire picture: when the sign started, which areas of the body are affected, whether the problem's seasonal or year round, whether there's recurrent ear or skin infections, what treatments have helped in the past, and what foods the pet has been eating. The pattern of disease gives us clues, but figuring out whether food is truly contributing requires a more careful process. So, if food allergies can cause itching, paw licking, and ear infections, why is it so difficult to figure out whether food is actually the problem? The biggest reason is that food allergies often look very similar to many other conditions we see in veterinary medicine. When a veterinarian sees an itchy dog, we're not just asking, does this dog have allergies? We're asking what is most likely contributing to this problem. Is it environmental allergies, flea allergy dermatitis, food allergies, parasites, skin infections, or something else? Sometimes more than one problem is happening at the same time. For example, a dog could have an environmental allergy and a flea allergy, or a dog could have an environmental allergy and secondary skin infection. This is why simply seeing that a dog is itchy doesn't tell us the answer. The other challenge is that food changes often happen at the same time as other treatments. For example, an owner might switch foods while also starting medication for an ear infection, skin infection, or inflammation. If the pet improves, it's understandable to think the food must have fixed the problem. But the improvement might have happened because one of the other changes that occurred at the same time, and not actually because we changed the food. This doesn't mean that the food wasn't involved. It means that we have to be careful about assuming we know the cause based only on timing. Another important point is that simply changing from one regular pet food to another is usually not a reliable way to diagnose or treat a food allergy. Many over the counter diets are not designed to be used as diagnostic tests, and trace amounts of other proteins may be present because of how pet foods are manufactured. Because of this, veterinarians typically use specially selected diets and a strict feeding plan when trying to determine whether food is truly contributing to a pet's symptoms. The goal is not simply to find a different food. The goal is to gather enough information to determine whether food is actually part of the problem. And that brings us to one of the most important parts of diagnosing food allergies: the food trial. So, if simply changing foods does not tell us whether a pet has a food allergy, how do veterinarians actually figure it out? The answer is a strict food trial. A food trial is not just switching your pet to a different food and seeing what happens. It is a diagnostic test designed to answer one specific question: is something in my pet's diet contributing to their symptoms? To get an accurate answer, the trial has to be very controlled. During a food trial, your veterinarian will typically recommend a specific diet, and your pet needs to eat that diet exclusively for a period of time. This usually means feeding only that recommended food and avoiding anything else that could contain other ingredients. That includes things many owners don't immediately think about, such as treats, table scraps, chews, supplements, and flavored medications, unless approved by your veterinarian. The reason that this matters is because even a small amount of another protein source can interfere with the results of the trial. Think of it like an experiment. If we're trying to determine whether one specific ingredient is causing a reaction, we have to control as many other variables as possible. If multiple things are changing at the same time, we lose the ability to know what actually made the difference. This is why a food trial can sometimes feel frustrating for owners. It requires consistency and patience. Most food trials are performed for several weeks, often around 8 to 12 weeks, because it can take time for inflammation in the skin and ears to improve, and for the food to kick into the system. A common mistake is stopping too early because there hasn't been an immediate change. But the purpose of the trial is not to see whether your pet likes the food or whether they improve after a few days. The purpose is to give the body enough time to respond and allow your veterinarian time to evaluate whether food is truly playing a role. It is also important to understand that food trials are not always easy. Pets may beg for their normal treats. Family members may accidentally give table scraps. Medications may come in flavored forms. These things are understandable challenges, but they can make it much harder to interpret the results. The more consistent the trial is, the more useful the information becomes. A successful food trial gives your veterinarian valuable information. If your pet improves while eating only the trial diet, that tells us that food might be contributing to your problem. However, your veterinarian may recommend reintroducing the previous diet to confirm that the original food was actually responsible. If your pet doesn't improve, that tells us we need to consider other causes such as environmental allergies, flea allergies, or other skin conditions. The most important thing to remember is this: a food trial is not simply trying a new food. It is a carefully designed test that helps your veterinarian determine whether food is actually a part of your pet's problem. After hearing about the food trial process, many owners understandably ask, can we just run an allergy test and find out what my dog's allergic to? It seems like that would be the easiest solution. Unfortunately, diagnosing food allergies is not that simple. There are many tests available that claim to identify food allergies, including blood tests, hair tests, and other types of allergy panels. However, these tests have not been shown to reliably diagnose food allergies in dogs. A positive result does not always mean that a specific ingredient is actually causing your pet's symptoms. And a negative result doesn't always mean that an ingredient is not involved. Because of this, veterinarians typically do not diagnose food allergies based only on the results of an allergy test. Instead, the diagnosis is based on overall picture, your pet's history, pattern of symptoms, ruling out other possible causes, a strict food trial, and whether we see improvement while on the trial diet. It's important to understand that allergy testing does have a role in veterinary medicine. For example, testing can sometimes help identify environmental allergens in pets with confirmed environmental allergies and might be used to guide certain treatments. But when we're trying to determine whether food is causing a problem, the food trial remains the most important diagnostic tool. The reason's simple. The goal is not just to find something that your pet reacts to on a test. The goal is to determine whether avoiding a specific ingredient actually improves your pet's symptoms, and that requires a carefully controlled process. So, what happens if your veterinarian determines that your dog truly does have a food allergy? The good news is that once we identify the problem, food allergies are often something that can be successfully managed. The main goal is to avoid the ingredient that is triggering the immune response and find a diet that your pet can tolerate long term. For some pets, this may mean continuing the diet used during the food trial. For others, your veterinarian may help transition your pet to another appropriate diet based on their individual needs. The important thing to remember is that there is not one best single diet that works for every pet. Every dog is different, and the right diet depends on many factors, including their medical history, nutritional needs, and what they tolerate. Another important point is that a food allergy does not mean your pet cannot have a good quality of life. Many dogs with food allergies live happy, healthy lives once the triggering ingredient is identified and avoided. The goal is not to find a perfect or trendy diet. The goal is to find a diet that supports your pet's health and keeps them comfortable. Your veterinarian can help guide that process and make sure your pet's nutritional needs are being met while managing their allergy. Food allergies can be a frustrating topic for both pet owners and veterinarians because the signs can look very similar to many other problems. A dog that is itchy, licking their paws, or dealing with recurring ear infections may have a food allergy, but those signs can also be caused by environmental allergies, flea allergies, infections, or other conditions. That is why diagnosing a food allergy requires more than simply changing foods and hoping for improvement. Today, we talked about how food allergies occur when the immune system reacts to a specific ingredient in the diet. We discussed why food allergies often cause skin and ear problems rather than just digestive issues. We also talked about why a strict food trial is such an important part of diagnosis and why it needs to be treated as a medical test rather than just a normal diet change. If there is one thing I hope you take away from this episode, it is this. Finding out whether food is contributing to your pet's symptoms takes a patient and careful approach. Changing foods repeatedly may feel like you're making progress, but without a structured process, it can be difficult to know what is actually helping. If your dog is struggling with ongoing itching, skin problems, or recurring ear infections, talk with your veterinarian. Your veterinarian can help determine what may be contributing to your pet's symptoms and guide you through the appropriate steps to find a solution that works for your individual pet. I hope this episode helped you better understand food allergies in dogs and why diagnosing them requires a thoughtful approach. If you found this video helpful, please consider liking the video and subscribing to the channel. And if there's a veterinary topic you would like me to cover in a future episode, leave it in the comments below. I'm Dr. Matt Clark. Thank you for joining me for Beyond the Vet Visit, and I'll see you next time.